I'm Dr. Ken Wu. I'm an emergency physician. I work in the accident emergency department in the Queen Elizabeth Hospital. We provide medical support for Oxfam trail workers since 1996. But because of the demand, more and more volunteers from the hospital help the event. So we extend the service from the whole Kowloon Central Cluster. We need every year we need over 200 volunteers to cover the whole the trail. Okay. I'm just going to talk about the common medical problem we see during the trail walker. But before that, oh, sorry, this is the introduction. Just to remind you, all of us are volunteers. So please be kind to our nurses. You know, we have some occasions and people have a problem with the medical service, and they didn't like the treatment they had. So at the end, there were some conflicts in the medical tent, and we didn't want this happen. But we want you to have a safe event, and we want you to finish the whole trail. So we would provide whatever necessary. But of course, we cannot move the whole accident emergency department into the trail. So we provide first aid service. We don't provide any massage service. If you need any massage or any physio, you can go to checkpoint 4, checkpoint 8, or finish point. There will be toilet physiotherapists to help you. Many years ago, we have a problem. The walkers came into the medical tent asking for massage. The nurses say, "Oh, we couldn't do the massage. We just provide first aid." And the walker was really angry, and he starts shouting at the nurses. And I thought it was quite unnecessary. But anyway, just I hope you can spread the message to the other walkers as well. Right. It's always prevent better than the cure. So we want you to prepare the trail thoroughly. You need to know the trail well, and you need to train yourself, prepare physically and mentally. Before I go to the common medical problem we see on the trail, something I would like to mention is the pre-participation examination for everybody. This is mainly for cardiac risk. It haven't happened during the trail walker, but it happened during the training. Someone have a cardiac cardiac arrest during the training many years ago. So we want to remind our walkers to be safe. So if any of you have complain or have experienced chest pain or discomfort during exercise, this is a very important sign to exclude any cardiac problem, any heart problem. If you have experienced unexplained fainting or near fainting, is another crucial sign and symptoms. If you experience excessive breathlessness, fatigue, or associated with exercise, you have to be very careful. There's some, your body is telling you there's something going on with your heart. Or if someone, if someone tell you during the medical examination you have a heart murmur, you have to be careful. There may be some congenital heart problem. Or if you have a family history of premature death before age of 50 due to the heart disease, or family history of inheritable heart disease, you have to be careful. Or if you personally have a history of heart disease, stroke, or peripheral artery disease, and also if you have the diabetes, diabetes, smoking, hypertension, and high lipid level, you need to be aware. And also the last one, if for men over age of 45, for women age of over 55, if you have any concern, any query, we advise you to see your own doctor. You might have to arrange some more investigation to check your heart if there's any heart problem before you go to have this endurance exercise. Okay, how many of you are first-time walker in trail walker? Well, quite a few. Okay, good luck. I'm sure you enjoy it. I've done it quite a few times. Every time when I was doing it, I said, well, why was I doing it? I kick myself and, but at the end, after I finish, I want to do it again next year. It's always like that. Okay, there's a lot of medical problems we see during the trail walker, but I just want to concentrate on the field we see on all kinds of endurance exercise. Blister is one of the most debilitating and common problem we see. During the event, if you develop blister, that is too late. Yeah, because once you develop blister, that means your skin is damaged. So the blister is an inflammation reaction. So if you have a blister, you come to see us. A small one, we normally just give a small dressing, protect it, hope it doesn't extend. Hope the blister doesn't get bigger. But if the blister is big, we will aspirate the blister for you at the medical tent. And this one is quite infected. So you have to be careful if you see any, this is a fresh blister, but if you see redness, that means it's got infection. Probably you need a dressing, a proper dressing, a cleaning, and then when you finish the event, you probably have to go to see your own doctor to get some antibiotics. Yeah, I'll just talk about this. Yeah. This is the dressing we can provide in the medical tent. This will give you some relief to ease the pain. But once the blister is developed, it's very painful. So during your preparation, when you train, you make sure your shoes, your socks is the right one for you. I can't recommend any socks or shoes for anyone because different people have different need, and your endurance capacity also affect the whether you will develop blister or not. I always advise people to have the shoes is not too tight. After a long walk, maybe your feet will get bigger. So I always advise you to buy shoes with at least one size bigger. After 30, 40 kilometer walk, your shoes will expand by at least half a size. So be careful. Okay. In last few years, we also see blister developed with the taping. So this is the Carnesi tape for the knee pain. So when they remove the tape, the blister, we can see blister underneath the tape. It's not too debilitating, not like the foot blister, because they are very painful. But this one, you just have to be aware. The shoes are, this is my own big toes. I thought my shoes was okay. I bought one size bigger, but still when I went down the slope, my toe will start hitting the front of the shoes. And after 50 kilometer, bruising start to develop. If it is painful, it's difficult to treat on the trail. If you go to the hospital, we can stick a hole in your nail to release the blood. But during the trail walker, it can be difficult. So beware of this problem. The other common problem we see is knee pain. There are many different causes of knee pain. But during the event, most of the knee pain we see are overuse. If you are walking 100 kilometers, do you know how many steps will you encounter after? Any guess? A lot. Many years ago, my colleagues did. He carry a step counter, and I think the short one, he have a smaller step, and he had 150,000 steps. Yeah, for taller person, if you have longer legs, he had 120,000 steps. So between 120,000 to 150,000 steps. So after so many repeated movement of your knee, there are a lot of overuse problem. And one of the commonest problem we see is the iliotibial band. I'm sure if you are into long distance running, iliotibial band is it's very common. It's a fibrous band stretching from your hip to your knee. So if your band is tight, after so many repeated friction, it will cause inflammation on the side of your knee or the hip, and it can be very painful. When they happen, normally they will walk like this. Every step is painful, and if you continue, the pain will only get worse. So if it happens during the event, you can come to the medical tent. We can give you some analgesic balm. You can rub on the painful area. That can help to ease the pain. Or if you can go to the physiotherapy station, they can do some stretching and do some release the tendon on the tension on the band. And in the medical tent, we can also provide the bandage to support the knee. If the pain is really bad, there's no point of continue. I remember from Beacon Hill going down to the Shatin Pass. After checkpoint 5, there are a lot of taxi on the road. They are waiting for you. If you have pain, you just go onto the taxi. I don't know if the physiotherapy provide ice on the trail. Oh, that's good. So we use the rest, ice, compression, elevation for most of the soft tissue injury. Exhaustion is very common. After the first day, you feel tired, you feel sleepy, and this is what happened. This is checkpoint 7. After 20, I think about 16 hours. On the next morning, it was 6 o'clock in the morning. You can saw these people lying on the couch. They were having a rest, very cold and tired. It looked like a temporary mortuary. That's what I thought when I walked into the tent. Yep, exhaustion is not only physical, it's also mental. Because I presume most of you, won't, walk overnight usually. This is a rare occasion. So you need to prepare yourself in different conditions, because the weather can change quite rapidly during the trail walker. I think the most the determining factor whether you can finish the trail walker is the weather. It can be very warm in the morning and very cold at night. So you need to prepare yourself. We always advise to bring the appropriate clothing and the dietary support. So your support team is important. They will carry a lot of stuff for you. They will give you the food, and they can change. You can change clothes at different checkpoints. Muscle cramp. I'm sure if you are into any exercise, muscle cramp is very, very common. There are a lot of people think salt deficiency or salt depletion is the cause of muscle cramp. But if you look at many journals, the cause of muscle cramp is still not fully understood. It is definitely not caused by sodium depletion. We have done some blood tests with people who have muscle cramp. It didn't show there was a depletion of sodium. So the reason we still don't understand. But during a lot of endurance events, a lot of people take salt tablets to prevent muscle cramp, but that is a myth. But from our experience, salt tablets can cause stomach irritation. We have seen quite a few walkers. They came to see us with stomach ache, vomiting, because of they were taking too many salt tablets. So be careful. When someone came to see us with muscle cramp, we will advise them to rest, take some fluid, maybe Pocari or any sports drink. Muscle stretching can be very useful. Another condition we see quite often, especially in the finish point. When they finish the event, all the adrenaline has come down, and they were dehydrated, and when they stood there, especially if they have a champagne, we have seen quite a few. They collapse at the finish point, and they smash their face and can be very dangerous. So we don't advise you to open champagne at the finish point, or at least you drink some fluid before you start drinking alcohol. Okay. Right. Yes, we don't recommend it. In the old days, beer and wine was being sold at finish point, but we have after a few incident, we stop selling. We advise not to sell alcohol at the finish point. The other problem we need to be aware is the temperature issue. Can be very hot, can be very cold. It can change quite rapidly. Heat exhaustion or even heat stroke. Fortunately, we haven't seen any serious heat stroke or heat exhaustion during the event, but you have to be aware. If you feel too hot, rest and take fluid and make sure you stay safe, and maybe you can change your clothes, yeah, and try to cool yourself down. You can spray water over your head. At night can be very cold. If it is, especially if it rains, sometimes it rains and the temperature can drop quite rapidly. If your clothes are wet, you need to change it. Trail walk Oxfam will provide some plastic bag. If it is too cold, you can just wrap yourself in the plastic bag and helps to keep the temperature. Yeah, and also your support team can help you to carry some extra clothing just in case if you need to change it. And make sure you have the weather update before the event. If there's any changes, you need to be prepared. Yeah. It's common advice. You need to rest in a safe environment. If you are not feeling well, keep your clothes warm, dry. If you feel cold, have some hot drinks, hot food. If you feel too hot, yeah, remove any excessive clothing and cool yourself down as quickly as you can. This is just a diagram. If someone have a heat illness, we can elevate the food and give him some fluid. These are just some photo we had. It was my team, and we have used some plastic bag to cover ourselves in a very cold evening. Okay, this is the end of my talk. Is there any question related to medical issue during the walk? If there's no questions, I will pass it to
Hi,
host.
I have one question. Hi. Hello.
Oh, there's a question on Zoom.
So I was just thinking about the temperature you mentioned. It's very hot or very cold, you said. So can you tell me how much degree is that? Very hot and very cold means.
Sorry. Can you repeat the questions?
So you told me that the temperature could be very high, hot, and very cold also. So can you tell me what is the degree of temperature? How much it goes hot? If it's hot, how much it is? And it's cold, then how much degree it is?
Oh, I think the highest temperature we have encountered, it was around 30 degrees Celsius during the day. At night, I think the coldest we have seen is about 5 or 6 at the top of the mountain. But that was just my guess because I didn't have a thermometer with me. If you go to Tai Mo Shan, the tallest mountain in Hong Kong, if you get there early in the morning, can be very cold. The wind can be very bad, so the wind chill factor make a big difference as well. So I would say 30 to 30 degrees Celsius hottest, 5 to 6 degrees Celsius coldest.
Thank you.
Ah. Okay, okay. Some the question, yeah, they will the Oxfam will answer your question later.